overarching message these last several weeks and also moving into next week is that health creation is a universal responsibility. Health is far more than our personal choices and the medical care we receive. As we've learned in the last couple of weeks, it includes consideration of housing, education, environmental stewardship, amelioration of violence, and supporting the impoverished. As a community, as a society, as a state, as a nation, in a global context, we need to provide different options for health. I first visited India with my wife Susie, who's a science teacher and a yoga teacher, and Dr. David Vastine and his wife Marcia. David and I first met at UCSF in the late 60s when we were on the general surgery service, and both of us wound up after service either in the public health service or in the US military, which all doctors were required to do in the late 60s, in ophthalmology. David as a corneal surgeon and me as an ophthalmic plastic and reconstructive surgeon. David met the team in India and the Aravind Eye Care family in the 70s when he was in India participating in the eradication of smallpox. Are we on here? Good. When we first visited India in 1983, the Aravind Eye Hospital was a fledgling institution, only recently started by its founder, Dr. Govindappa Venkataswamy. So you understand why he is fondly known as Dr. V. The definitive text on his history and the amazing work that he has accomplished is captured in a beautiful book by a member of the Venkataswamy and its extended family, Pavitra Mehta, who is here with us tonight, which is also a great, great honor. To be talking about the Aravind Hospital at this time is to be talking about different options for healthcare in the global context. When we first visited, there was one hospital, and Pavi will tell you how many hospitals there are now. Over the last 30 years of working at Aravind and sharing their challenges and their successes, Susie and I can't imagine what our lives would look like without the Aravind experience. I went there as a young surgeon, as you can imagine, full of myself, and went there with the idea that I had something to offer to surgery and healthcare in the developing world. I returned humbled by the volume, the quality, the skill, the knowledge of the people and of the work that they were doing, moved by the compassion witnessed, inspired by the generosity of spirit, and changed by the joy and commitment of the people we met and worked with. It is said, if you give a man a fish today, he is hungry again tomorrow. But if you teach a person to fish, he feeds his family for a lifetime. The model that we went to India with was that kind of partnership, local ways and new surgical techniques. And it was a wonderful coming together. As you can see in this picture in the operating room where there was no hot water at the scrub sinks. So once we had scrubbed with cold water and soap, one of the sisters, one of the nurses, came around with warm water in a silver pot that had been heated to actually rinse the soap off your hands before you went into the operating room. The surgeons were superb and wide open for learning. And today, as you see with Dr. Usha here, their work, their teaching, their impact on the surgical treatment of eye disease has far surpassed anything that I myself have accomplished. And looking across the street from what was the original Aravind Eye Hospital, now we see 3 new buildings, all of which were paid for by the activities of the existing hospital. 3 new buildings: a center for community ophthalmology, which is about training and education, an inpatient hospital where surgical and oncologic patients are managed, and a research center, all exemplifying the growth of the enterprise, and all part of a seemingly impossible mission and vision that Dr. V carried. All he was going to do was eradicate needless blindness in the world. Where did such an idea come from? Well, certainly Dr. V was influenced by his medical work in the world and by Gandhi. This was a time when Dr. V, who was born in 1918, was strongly influenced by Gandhi. And Sri Aurobindo and the mother of Pondicherry, contemporaries of Gandhi, who were always moved by and guided by inner wisdom. Sri Aurobindo wrote, this is a little esoteric, but I think pretty powerful. In a contrary balance to the earth's truth of things, the gross weighs less, the subtle counts for more. On inner values hangs the outer plan. Dr. Venkataswamy was the founder of the Aravind Eye Care System, a superb surgeon and teacher, a sage, and a saint. As you'll hear from Pavi, he was familiar with overcoming obstacles and motivated and stimulated by the seeming impossibility of his vision. So what distinguished what went on at the Aravind Eye Hospitals and the service that they rendered? This photo of Dr. Usha was on our way to the operating room one morning, and she is coming out of the meditation room where we started our day. The respect, commitment, compassion that was held, and the dignity of each patient, most of whom were the poorest of the poor and the sickest of the sick, but were never turned away for any reason if they needed care. What is different? The power of the unseen and the sacred, and doing what was right and what was needed. Some of what I have learned that has influenced my life and actually influenced the development of the Institute for Health and Healing relates to why it is that we serve. We serve to express gratitude. We serve to grow. We serve to honor our interconnection with all that surrounds us. And we serve to align ourselves with the natural world and creation's unfolding. I learned at Aravind that business principles are actually compatible with service in the world. That science actually can effectively coexist with the sacred, and that outer change and inner transformation are linked. Service changes our seeing, making our work generative and sustaining our personal resources. Sharing our skills and knowledge enhances the effects of our work. The evolution of organizations depends on the evolution of the individuals in it. A lesson all of us in the corporate practice of medicine can learn from. And to be of service to others is to serve oneself. Dr. V, with all of the challenges that he overcame, has taught us that our limitations do not define us. However, our aspirations might, if they lead to effort and action in service to the greater good, to our life's dream, and to our highest values. As one's self-awareness sharpens and deepens, our capacity for compassion grows, and we gain the potential to tap into a deeper wisdom as we become a more conscious instrument in service through commitment and practice.